Welcome to the Increasing Enrollment webinar for the First Breath program with the Wisconsin Women's Health Foundation. The objectives of today's presentation are to assist our providers with selecting an appropriate enrollment goal for 2014 and then discuss steps to take internally to help you reach these goals. The overarching objective is to help increase enrollment and reach for our perinatal health programs. Here is the agenda for what we'll be covering in this short presentation. So why are we asking sites to set an enrollment goal for 2014? First and foremost, because it allows us to increase our accountability. We, the Wisconsin Women's Health Foundation, are able to hold ourselves and our sites more accountable for outcomes when there are clear expectations. In addition, we are accountable to our funders, the Tobacco Prevention and Control Program, and Centers for Medicare and Medicaid Services. Having expectations for the number of women our sites are striving to reach also lets us better plan out material and incentive needs for the year, so orders can be filled faster. Finally, enrollment goals are also powerful because they allow us to focus on sites and areas that may need additional support. Secondly, we are asking sites to set enrollment goals because they work. Having an established goal when someone is holding you accountable to makes you more likely to succeed. 2013 was the first year in which enrollment goals were used, and the impact was noticeable. As of November 30th of 2013, our sites are on pace to enroll almost 20% more women than in 2012. That's nearly 250 more women receiving help than in the previous year. Goals work. So now that we've explained why we use these goals, let's talk about some points to keep in mind when you are setting a goal. An initial question to ask is, how many women did you enroll this year? If you enrolled 10 women in 2013, it might be good to aim for a number that is higher than this, but not so high that it's unrealistic. Another factor to consider is how many staff are actively enrolling women. Generally, the more staff you have trained, the more women you can enroll. One important point to note here is the word actively. In our experience, one highly motivated staff member will enroll more women than a dozen staff who are trained but less engaged. Along with this previous point, what is your current caseload? The more women you're working with, the more women you could enroll. It's also important to keep in mind the smoking rate of the population you are working with. Maternal smoking rates vary. The overall average for all of Wisconsin is just over 13% of pregnant women identifying themselves as tobacco users. It's important to note that this is the average for the state as a whole. Looking at county-specific data, you can find rates between 6 and 35%. Women of low income also tend to have much higher rates than that 13% average as well. Generally speaking, women who are younger, unmarried, and of low socioeconomic status are more likely to be dealing with this addiction. Identify your rate so you're familiar with how often you could expect a woman to be eligible. You may be able to specialize this using your own data. The annual site-specific report from the First Breath program will also be of use to you as well. This map shows the maternal smoking rate of each county in 2010. This information is from the WIC database and is based on birth certificate data. This map simply emphasizes the point that the 13% average is just that, an average. Be aware of what the rates in your community and among your population are. You will be receiving a packet in late December with your Memorandum of Understanding, contact update, and enrollment goal paperwork. We encourage you to take some time to really think about what kind of goal you would like to set for 2014. If you need help getting started, start with how many women you enrolled this year. Is there room for improvement? If so, what do you have to do differently to reach this goal? If you're a new site or just aren't sure where to start in selecting a goal, here's a suggested way to calculate this. Step 1. Take the total number of pregnant women served per year at your site. Then, Multiply this by the percentage of your population that smokes. This will give you the number of women who are eligible for the program. In other words, this is roughly the number of women who should receive a first breath invitation from your site. But not everyone is going to enroll, which brings us to step 2. Take that number of women eligible from step 1 and multiply it by the percent of women that typically accept enrollment. This varies depending on your individual site, but it can also be improved. We will get into some tips and suggestions for this in just a little bit. Once you've completed step 2, you have calculated an enrollment goal for your site in 2014. Congratulations! To see this in action now, we're going to provide you with 3 examples for different site types. The first is a PNCC program that serves 200 pregnant women per year. Based on program data, about 38% smoke, which means 76 women are eligible for first breath and will be receiving an invitation. About 3/4 of women typically accept participation at this site, so their enrollment goal is 57. The second is a private clinic. They see about 100 pregnant women per year with mixed income and demographics. Based on county rates, about 15% smoke. This means that 15 women are eligible for first breath and will receive an invitation. Almost all women accept the participation, and their enrollment goal is 14. Lastly, a WIC office. About 300 pregnant women receive care per year, all of low income, so estimation is that about 30% smoke, meaning 90 women are eligible for first breath and will be receiving an invitation. About 3/4 of these women accept enrollment, meaning the goal is going to be 67. Again, if you're not sure where to start, utilize this formula. So you have an idea for what your goal is. Let's look at some steps for helping you reach it. First things first, women need to be invited to the program. Think back to that number of eligible women. Were you surprised by this number? Most likely, improvements can be made to increase awareness of the program and ensure every eligible woman is offered participation. After all, if a woman isn't aware of first breath, how can she enroll? Another tip is to start early. If you're new to our programs or just haven't utilized them in a while, push yourself to start early in reaching women in 2014. This year, 85% of sites that achieved their goal enrolled someone in the first 3 months. Among those sites that didn't achieve their goal, less than half enrolled women in this time frame. Start early and it's much easier to reach that goal. Also, be sure that you have what you need. Where are the folders and incentives kept? They should be accessible for convenience and ease. Review the forms before your enrollment visit. This might take some planning, but it will create a smoother process for yourself and your participant. One of the biggest things that can help you reach your goal is to improve on your introduction or delivery. If introductions of the program is something you're not yet comfortable with or confident in, practice, practice, practice. This could be integrated at a team meeting or monthly check-in, and the more comfortable you are with the program content, surveys, and forms, the easier the words will roll off your tongue, providing confidence to the participant that this is a program worth taking part. Here are some suggestions from other first breath providers regarding program introduction. Experiment a little bit internally with various methods of promotion and marketing. Test out 2 or 3 ideas and see which has the best results. Posters in the waiting room, brochures in your welcome kits, maybe a display table at your front desk, or showcasing the incentive gifts. Ask us for supplies and assistance. Another idea would be to use a little friendly competition. You can do this internally, asking your staff to push themselves to try to see who can enroll the most women. You can also do this as a team. We send out enrollment updates once per month with our newsletter. Find a site that enrolled a similar number of women this year and make it a challenge to yourself to enroll more women than them in 2014. Keep an eye on this report to ensure that we're receiving all of the enrollments that you are putting your hard work and time into. To wrap up, let's discuss next steps. First, do your math, have a conversation, and make a decision about your goal with your team. Once you've got it, you will indicate it while completing the contact update form that is arriving with your 2014 mailing in late December. Please send this in to us along with the other paperwork. We will update our system with your goal and follow up on a bi-monthly basis. Lastly, figure out what needs to happen to reach that goal. Meet to discuss a plan of action, make adaptations as needed, or continue to succeed as you are. We are always here to assist with this step as well. For any questions, please contact your program coordinator. Thank you for all that you do. The First Breath program couldn't have the success that it does without our dedicated and fearless providers.